Hello, how would you like a punch in the nose? That's what the lady told me at the checkout line at a grocery store when I offered her some unsolicited advice about the proper wearing of her mask. Hi, I'm Jim McLaughlin, Professor Emeritus of Health Sciences at Purdue University. I'd like to briefly talk about the proper wearing of masks to prevent the spread of COVID-19. In this regard, I have 5 talking points. First is what is an improper mask? Second is what is a proper mask? Third, what is a proper mask worn improperly? What is a proper mask worn properly? And finally, how to improve the comfort and functionality of a proper mask worn properly. I'd like to briefly show you what I consider to be an improper mask. These are ones with the one-way valves that make it easier to breathe in wearing a respirator, but it doesn't prevent the spread of the COVID-19 should you be asymptomatic. So here's a person standing near you and showing you with this little candle experiment right here. You can see that basically as a person breathes out, all of that moisture that they may have, those particles can come right directly into your breathing zone, and you possibly can be exposed. A second, more subtle mask is this 2-ply mask right here. Person's also standing in line. Doesn't have a valve, but your person's wearing it. And because of the 2-ply fabric, the same thing can happen. So if you take, I don't want to pluck too many of these hairs out, I'm getting kind of thin as is. Here's a little hair, it's my hair right there. And so its diameter is about 60 micrometers, and a virus particle is about 60 nanometers, which means if you do some quick math, you can put about 1,000 of these virus particles end to end on each other all the way across the diameter of this hair. So to demonstrate how easy it is to pass moisture to pass through this mask, and certainly with no resistance at all with the one-way valves, these are improper masks in my opinion. Now, what is a proper mask? Well, you've seen many of these on the market. These are disposable masks. You can get about a box of 50 of them for about 20 bucks. I have these here. They do not say surgical mask on them, but the surgical masks are made of the same kind of material. They just don't have the bacteria filtering efficiency, particle filtering efficiency, or the fluid resistance of these particular face masks, but composition is the same. Usually it's a polypropylene material. The outer and inner layers, the outer layer here and the inner layer here, are spun bond polypropylene, basically to offer its strength. And the middle layer right here is a melt-blown polypropylene, and that's really the secret element in the mask material, because it doesn't have the tensile strength, but because of the way it's blown into the fabric, it has very good blocking characteristics in order to prevent moisture from coming, the larger particles coming from your mouth and exposing others, and possibly preventing the spread of the COVID-19. So just to demonstrate how the effectiveness of a polypropylene mask versus others is that if I take this particular mask and put it on properly, right here, try to blow out this candle, you can see that the protective properties for the larger moisture particles are going to be contained using this polypropylene material and its 3-ply layers. So what is the improper way of wearing the mask? Hence the punch in the nose from the lady, and she looked like she could throw a punch. I didn't want to take her on, but basically what was happening is that she was wearing a mask similar to this, but she had her nose hanging out like this, what we call the sniffer. And I pointed out that this is not helping matters, because if she's asymptomatic, her moisture coming from her nose standing near me could cause exposure to me, and I could become basically symptomatic from exposure to the SARS-CoV-2 and then get COVID-19. Other ways I've seen this is people wearing it around their chin, not helpful at all. Now you have both the mouth and the nose exposed to people standing next to you, and you certainly are exposing them that way. So those are the proper mask worn improperly. And I've seen people, more and more people wearing it this way. I think they just don't like wearing the mask. And there are a number of reasons why. Totally get this. One is that it may not be a good face seal. If it doesn't face seal, you can have your glasses fog up. How many of you had that occur? It's quite annoying. And you want to really make sure that that seal is as good as it can possibly be. Others, how about a runny nose? You know, trying to wipe your nose underneath the mask. It's a problem. So you're always breaking that seal, right, when you're trying to rub your face. Other issues are you have muffled verbal communication. A lot easier to talk this way than this way. You get muffled, you just can't quite hear what the person's saying. There's some breathing resistance that occurs. Slight increase in temperature inside the mask because of this little microclimate in there. As a result of that, you can also have a buildup of bacteria causing folliculitis over time, the skin irritation. If you're wearing facial hair, if you have facial hair, it's a problem. And then also just some people get very anxious wearing the mask, or they feel claustrophobic and really don't like wearing it. But in this times of COVID, and we are really ramping up right now, we are just, the darkest days are ahead of us after Thanksgiving, before Christmas. So many people traveled and so on, and we're seeing over 2,000 deaths a day in this country from COVID-19, and hence the importance of wearing a mask to try to at least do your part in preventing the spread of COVID-19, but also the protective elements of wearing this mask yourself and at least capturing some of those larger particles that may come towards your face. So let's say you're forced to wear these masks a longer period of time. Let's say you're a person at that checkout counter at the grocery store, you have to wear the mask. It becomes uncomfortable to wear these as designed. So there are a couple of ways to deal with this. One is what I call something to take the stress off the ears. And this is basically to put it over your head like this, put it down. You can see now the loops are not pulling on my ears. A lot more comfortable this way with a little band in the back. And then a second thing I like is what's called this little turtle frame that you can put between the mask and your face. And so I just basically slip this in here over my nose and my mouth. And now I have a nice little bridge between the mask and my mouth. It allows for easier communication. You don't see it sucking in and out as you've seen so many of these masks do when people are talking. But it's more comfortable in terms of the climate, less skin irritation and so on. And it's a little more comfortable to wear over a long period of time. Mind you, you still have some small gaps here, but in terms of usability and functionality and comfort, much, much better when you're a little more creative about having a band taking pressure off your ears and the mask directly off your face so that you can more easily communicate and then wear it for longer periods of time. So I hope you found this information useful and in regard to engaging you to stop the spread of COVID-19 from each other. Masks do work. The science is there. We're learning more and more about this every day, but why not wear the mask, protect others, protect yourself, so that you are not in the ICU at Christmas and over the holidays, and you're protecting your loved ones and others around you. Thank you very much for your time and attention.